Emergencies can happen at any time, and knowing how to respond can make a crucial difference. In this video, we'll be covering 23 different emergency scenarios and providing you with essential advice for each one. So, whether it's a heart attack, a severe burn, or a natural disaster, we'll help you be prepared. Let's get started. Number 1. Heart attack. Signs: chest pain or discomfort, shortness of breath, nausea, lightheadedness, and sweating. Advice: call emergency services immediately. Keep the person calm and seated. Offer an aspirin if the person isn't allergic. If the person loses consciousness, begin CPR and use an AED if available. Number 2. Stroke. Signs: sudden numbness or weakness, especially on one side of the body, confusion, trouble speaking, vision problems, and severe headache. Advice: call emergency services right away. Note the time symptoms started and keep the person comfortable. Number 3. Severe bleeding. Signs: large or deep wounds, blood spurting or pooling, inability to stop the bleeding. Advice: apply direct pressure to the wound with a clean cloth. If possible, elevate the injured area. Call emergency services and keep applying pressure until help arrives. Number 4. Burns. Signs: redness, blistering, white or charred skin. Advice: for minor burns, cool the burn under running water for at least 10 minutes. For severe burns, avoid removing burned clothing. Cover the area with a clean cloth and seek immediate medical attention. Number 5. Seizures. Signs: uncontrolled jerking movements, loss of consciousness, and confusion. Advice: protect the person from injury by clearing the area around them. Do not restrain the person or put anything in their mouth. After the seizure, check for breathing and place them in the recovery position. Call emergency services if the seizure lasts longer than 5 minutes or if the person has another seizure soon after. Number 6. Poisoning. Signs: nausea, vomiting, difficulty breathing, confusion, and seizures. Advice: call the Poison Control Center or emergency services. Provide information about the substance ingested if known. Follow their instructions and do not induce vomiting unless advised by a professional. Number 7. Asthma attack. Signs: wheezing, shortness of breath, chest tightness, and coughing. Advice: help the person use their inhaler. Encourage slow, deep breaths. Number 8. Drowning. Signs: struggling to breathe, failing arms, unresponsiveness. Advice: remove the person from the water. If trained, perform rescue breathing and CPR. Call emergency services and keep the person warm until help arrives. Number 9. Fractures. Signs: pain, swelling, deformity, inability to move the affected area. Advice: immobilize the injured area. Apply ice to reduce swelling. Seek medical attention and avoid moving the person if a neck or back injury is suspected. Number 10. Electric shock. Signs: burns, unconsciousness, muscle spasms. Advice: turn off the power source if safe. Do not touch the person directly if they are still in contact with the electricity. Call emergency services and perform CPR if necessary. Number 11. Panic attack. Signs: rapid heartbeat, shortness of breath, dizziness, fear. Advice: help the person focus on slow, deep breaths. Encourage them to breathe into a paper bag if hyperventilating. Provide a calm and reassuring presence. If symptoms persist, seek medical advice. Number 12. Snake bites. Signs: puncture marks, swelling, pain, possible venom effects. Advice: keep the person calm and still. Immobilize the bitten limb and keep it at or slightly below heart level. Avoid applying ice or tourniquets. Seek immediate medical attention. Number 13. Eye injuries. Signs: pain, redness, blurred vision, tearing. Advice: do not rub the eye. Flush with clean water or saline solution if a foreign object is present. For chemical exposures, flush for at least 15 minutes. Seek medical attention. Number 14. Diabetic emergency. Sign: confusion, dizziness, sweating, shaking, loss of consciousness. Advice: if the person is conscious and able to swallow, provide a sugary drink or snack. If they become unconscious, do not give them anything by mouth and call emergency services. Number 15. Fainting. Signs: lightheadedness, weakness, loss of consciousness. Advice: lay the person down and elevate their legs. Check for breathing and responsiveness. If the person does not regain consciousness quickly, seek medical attention. Number 16. Carbon monoxide poisoning. Signs: headache, dizziness, weakness, upset stomach, vomiting, and chest pain. Advice: move the person to fresh air immediately. Call emergency services. Administer CPR if the person is unresponsive and not breathing. Number 17. Suicidal thoughts or actions. Signs: expressing a desire to die, seeking means to harm oneself, talking about feeling hopeless. Take the person seriously and stay with them. Remove any means of self-harm. Call emergency services or a crisis hotline for immediate help. Number 18. Gunshot wounds. Signs: bleeding, pain, loss of consciousness, difficulty breathing. Advice: apply direct pressure to the wound with a clean cloth. Keep the person calm and still until help arrives. Number 19. Childbirth. Signs: contractions, water breaking, crowning. Advice: if birth is imminent, ensure a clean environment. Support the baby's head as it emerges and do not pull. Keep the baby warm and dry and monitor both the mother and baby until help arrives. Number 20. Chemical burns. Signs: redness, blistering, pain, possible swelling. Advice: flush the affected area with copious amounts of water for at least 20 minutes. Remove contaminated clothing. Seek immediate medical attention. Number 21. Gas leak. Signs: smell of gas, hissing sound, dizziness, headache. Advice: evacuate the area immediately. Do not use electrical switches or devices. Call the gas company from a safe location. Number 22. Blizzard or severe winter weather. Signs: heavy snowfall, high winds, cold temperatures, poor visibility. Advice: stay indoors if possible. If caught outside, seek shelter and avoid overexertion. Keep a winter emergency kit with blankets, food, water, and a flashlight. Number 23. Tornado. Signs: dark, often greenish sky, large hail, a loud roar like a freight train, and funnel cloud. Advice: seek shelter in a basement or an interior room on the lowest floor. Avoid windows, protect your head with a sturdy object or your arms, listen to weather updates, and wait until it is safe to emerge. Remember, staying calm and knowing the right steps can save lives. If you found this video helpful, please give it a thumbs up and share it with your friends and family. Don't forget to subscribe to our channel and hit the bell icon so you never miss an update. Stay safe and I'll see you in the next video.